Brady here with In Strength Check. Riffs, dice, and a bit of neurospice, hobbies, riffs, and mental health, all that kind of good stuff. So everyone, this is going to be probably a difficult episode for me, a difficult episode to listen to. In the show notes, I will have multiple content warnings. This is actually going to contain a lot of pretty sensitive and triggering content. We're going to be discussing some pretty heavy things, to be perfectly honest with you. We may touch on topics ranging from things like suicide and self-harm to drug abuse, trauma, and psychosis. So if you're feeling like that's something that you might not want to kind of engage with right now, then just giving you the heads up. The reason that I say that is because, and the reason I say I've been a bit reticent to engage with this episode is, to be honest, I've got a lot of frustrations, stigma, and just a lot of, I guess, annoyance with the way that the discourse is turning out for ADHD and neurodivergence in general. Not just from the greater public, but even from within the neurodivergent community itself. So look, this is going to be a pretty probably contentious episode. I will endeavour my best to frame this in, I guess, ultimately a context of pride and empowerment for myself and others living with ADHD, but I am kind of starting to get a bit fatigued by a lot of the discourse around neurodivergence and the response to it. So I actually wanted to offer something that's more, I guess, complex and a bit realistic for my own sake. And I really wanted to portray something that actually gets to the heart of what it's like living with ADHD, and not necessarily from a hand-holding kumbaya perspective. So this has been a difficult episode for me to think about. It's been difficult for me to try and prepare and try to write because, just the nature of it. So I just want to give a heads up. And it's likely that, I'm not looking to pull any punches with this. I'm not looking to placate anyone, myself included. So, rather than be kind of, triggering the libs, trolling, anything like that, I just want to frame that this is going to be probably, number one, a little bit all over the shop, because I think in true neurodivergent affirming style, rather than sit there and like I do with many other things and feel like I need to meticulously and perfectionistically plan a script or anything like that, I feel like this is best done raw, so to speak. And so there might be a lot of pauses and ums and ahs and that sort of thing, so it might not be the best quality episode. But I think from a lived experience and a peer perspective, that's probably the best way that I can deliver it. So, look, I've done a bit of a more, I guess, technical kind of introduction here, and I just wanted to point out some primer thoughts from a more empirical and biopsychosocial, so biological brain, psychosocial, internal, and community things. So just my little sort of more clinical sounding spiel here. So for me, being neurodivergent, living with attention deficit hyperactivity disorder, ADHD, which for me, I am the inattentive type. So you can think of all my references of ADHD as actually pertaining to the old DSM-4 formulation of ADD, okay? It can significantly influence deep-seated personality and biopsychosocial factors. So I want to explore this very briefly from a conceptual perspective. So from a more scientific perspective, let's first of all talk about the neurobiological impact. ADHD is associated with distinct neurobiological differences, particularly within the prefrontal cortex. Specifically with ADHD, one of the main deficits is a lack of blood flow to the front right prefrontal cortex. And that's sort of the seat of your brain that plays a lot of a CEO type role. It's very crucial for executive functions like attention, impulse control, and organization. And I'd like to point out that I think one of the things that's been sort of frustrating to witness is that I think a lot of people are jumping the gun with ADHD and either making assumptions around what it is or what it isn't, or making assumptions that they may identify it due to those executive functional deficits. And I'd like to point out that stress, depression, anxiety, personality disorder, and even just biological factors, mood, sleep, that sort of thing, can really in the short and long term mimic ADHD. And I think that's why there is a lot of dismissive sort of rhetoric around it, because really you guys will have seen ADHD stuff, right? You've seen it, it's everywhere. Therein is part of the problem, and I will go into that, and part of the solution. So look, let's just give, with these neurological variances, we can talk about things, influencing personality traits. So for instance, those of us with ADHD, we struggle a lot with impulse control, which can lead to impulse decision making and behaviors that can act to shape our personality in ways that are positive, but a lot of the time in ways that we might regret, which leads to my second point around emotional regulation. Again, shared and consistent Venn diagram overlap with many other mental health issues or challenges. Many individuals with ADHD, we experience challenges in regulating our emotions, and this leads to mood swings and emotional sensitivity. This emotional dysregulation can impact interpersonal relationships and personality development, and over time it can contribute to the development of some pretty entrenched maladaptive coping mechanisms and even defensive traits. And that often leads to a perception that people with ADHD can be difficult, because we can, honestly, we can. I know I am. I try my best, but I can be difficult, and that's hard. So deficits in our executive functioning can affect an individual's ability to plan, to set goals, maintain routines, stay on task, prioritize. All these things can lead to feelings of underachievement, which in turn may influence our self-esteem and our overall self-concept. I would like to argue that the biggest problems for me as someone with ADHD is self-esteem and self-concept, and I'm going to frame this later in the terms of how helpful the diagnosis has been and why I'm so irritated and disturbed, honestly, around the way things are going. And from a more lived experience perspective, look, we struggle with consistency, okay? So living with ADHD, that often means navigating inconsistencies in our daily life. One day we might be highly productive, and then the next it can just be inattention and procrastination. Even today, it's taken the whole day of ruminating and avoidance to even hit record on this. So that's just a chronic feature of my everyday life. Anyway, so that inconsistency can lead to feelings of frustration, self-doubt, and impact our self-identity and our resilience. And I think there's a lot of overlap with social interactions, to the point where there are quite a number of folks who have been assessed for ADHD and things like autism or personality disorder. And while those factors might have been ruled out, we still have significant difficulty with our social interactions. For me, that's been one of the biggest kind of touch points. Difficulties with impulse control and maintaining focus, that can affect our social interactions. So an individual might interrupt others, struggle with active listening, or we might inadvertently offend others, not without knowing, not out of malice. And these challenges may lead to feelings of social rejection or isolation, which can also influence the development of certain coping strategies and interpersonal dynamics. It's very interesting for me in my work as a mental health clinician. I won't get too far into this, but in the DSM-5, which is the diagnostics tool that we use for formulation, that sort of thing, I notice a lot of people being assigned, I guess, a working diagnosis, which is where it's like, well, it could be this, could be that. One thing that comes up often, we call it a bit of personality flavor. Traits like, for things like dependent personality disorder or even narcissism. particularly some social dynamics really do mimic a lot of things that we see in, say, borderline personality disorder, and I'm going to touch on that later as well. But just to be a little bit more positive for a second, ADHD brings adaptive traits. I truly think that I'm alive today because of ADHD. I struggle every day, but I would also say with everything else I have going on in my mental soup and baggage, it's also interesting though. I think ADHD brings so many challenges, but it can also foster adaptive personality traits. So it's like Homer when he says, to alcohol, the cause of and solution to all life's problems, right? So, developing resilience, creativity, lateral thinking, unique ways of problem solving. And I think that can contribute positively to personality development and this ability to adapt to various situations. And the journey of accepting and embracing neurodivergence, it can be a really pivotal aspect of developing our personality. Personality isn't static, it's fluid. And I've found that my personality has actually changed quite positively through the diagnosis process, which is why I'm also frustrated with a lot of the rhetoric around ADHD. So we kind of undergo this sort of self-discovery and personal growth process because we learn to accommodate and leverage our traits. Medication does not fix everything. I was diagnosed at 31. I have 34 years of behaviors and traits that no medication or behavioral strategies or productivity or planning has quote unquote fixed. But I mean, similar to the feedback we might give to someone with a mood disorder, medication and looking up some strategies alone isn't going to fix it. It involves a lot of maintenance, too much maintenance to be honest. So yeah, look, that's a little bit more of a technical spiel, and now I want to dive into a more personal thing. You might hear me kind of clicking around and stuff. I've got a bit of a rough script here, and I'm drinking some coffee. So look, rather than give you guys some pithy spiel about holding hands and singing fucking Kumbaya, I want to pull no punches today. I'm pretty ropeable. I'm pretty sour with, I feel, around how ADHD discourse has developed. I think big tech and social media have actually severely damaged what was initially quite a positive movement. And it's to the point I'm starting to get disgusted with it, to be honest. Today's episode took a lot of guts, and even as I'm talking, I'm kind of preemptively and actively working through some stigma, shame and guilt. They're quite common parts of my experience of having ADHD and being too self-conscious about it. So this might be a bit bleak and vitriolic in places and some traumatic and triggering content. And I'm trying to make an effort to coach this in a framework of some hope and optimism, but to be perfectly honest, it's not my fucking responsibility to coddle any of you either. Friends, family, anyone. I'm kind of past my limits in that regard. Like, I can be diplomatic, but I just really need to say my piece. So look, if you want a little bit more of a nuanced and honest and in-depth understanding of how ADHD, it's not just attention, it's pervasive, it's complex, it's embodied, it's inseparable from those living with it. It is just a label at the end of the day. It is just a disorder, but the, I guess, complexity and the reach of this illness, it does sort of define who you are and you define it. So I invite you to listen if you are interested in this perspective. And I want to dedicate this, I've lost people I know to this illness. You can definitely say there's a lot of comorbidities, but I'm just going to say off the bat, for someone to have ADHD and to not have some mental health comorbidities, it's frankly almost unheard of. And the statistics on that don't lie. 80+% co-occurrence of mood disorder over the lifetime, and even at any point of testing. So if you actually kind of what they call cross-sectionally study people across their lifespan, a lot of ADHD folks, at any point you ask them, they'll actually have like clinically significant mental health issues. And for me, it's interesting in my journey. I'll talk a little bit about my mental health journey, both from the perspective of a social worker and someone who's been through it myself. I would say ADHD is the root causal factor of pretty much most, if not all, of a lot of my mental illness issues. So I just want to put that there because I really still feel like there's a lot of misconceptions and misunderstandings, and that ADHD, especially with the memes and everything that's going around, it can look very surface value, we'll sort of do that sort of thing. But I'm going to be honest, like, I'm dedicating this episode more than anything, not just for myself, but people I know, I won't say who they are, but they're no longer with us, and that is due in no small part, I think, as a direct consequence either to exploring or awaiting a diagnosis of ADHD or struggling with living with it. So I'd like to offer, if you're listening to this as a perspective of someone who doesn't have it or is querying it or has the care of someone else with ADHD, I hope I can give you some honest insights from another point of view, because who knows, it may just inadvertently save someone you know's life. So just please consider that. So according to Chad, October is ADHD Awareness Month. And yeah, I'm sure you're already thinking, people are already thinking things like, you just need to this, you just need to that. No. 34 years of that from everyone is enough. So I'm asking for you, the listener, sit down, shut the fuck up, and listen to us for once. So if you guys actually give a fuck about, air quotes, awareness raising, and I'm doing physical air quotes here, if you actually genuinely want that awareness, you need to be challenged. I need to be challenged, because what forms part and parcel of gaining insight and awareness into mental illness, both for people managing it, living with it, that sort of thing, it's being challenged. And if you're starting to really, really tire a lot of these elements around ADHD within the greater discourse, especially online, even or perhaps especially amongst neurodivergent folk, I'm sure you may know someone who was recently diagnosed and you think that's all they're fucking talking about. And, you know, if that last question, and it's what's the tea style implications, has got you interested in some vicarious drama, or you might even be sitting here with a pen and paper getting ready to timestamp this so you can dox me, well, I invite all of you to listen in. I'm going to choose to be vulnerable for this, and that vulnerability is going to come with some stubbornness, defiance, to be honest. This isn't a dialogue today. I'm talking to you. I'm not inviting anyone into this space. Again, air quotes. I'm going to be talking at you. I'm going to be talking at you a lot. And those who know me know that I have a proclivity to talk, which is why a podcast is helpful. You'll either listen or you won't. It's not my funeral. Not yet. So I want to speak out for my own position. And I don't know if it's going to be an agreeable or defensible one. But I just have to be as honest as I can, okay? And I don't mean any of this to be edgy. Those who know me know that if anything, sometimes I'm a diplomatic kind of guy. I'm very agreeable, I'm personable. Sometimes I can come across as a little too measured, a little overly apologetic, a little overly verbose, and it might even be construed as just trying to be diplomatic or centrist or whatever, and that's part of the illness. So I want to put aside at that for this episode. And if you want something flowery or pithy or handholdy, go look at some relatable memes on Reddit or some shit. I don't care. I'm off the clock, okay? So I'm going to save the measured, sober, social worker tone for work. And I think, people might think, typically, I'm a pretty sensitive guy, and I am. And I have ADHD to both thank and blame from that too. So thanks, brain. I'm not just going to sprout lofty, whimsical pieces about how we should all sing together, like that scene in going back to The Simpsons, where Lionel Hutz is like the vision of a peaceful world together, and he just So yeah, in this instance, I am Lionel Hutz because I'm shuddering that thought. Look, speaking of, he's a great caricature of what life actually looks like with ADHD. Substance abuse, brazenly daft social faux pas, accepting things way beyond his means, putting his foot in his mouth, and all with this kind of simple, smarmy, but also weirdly endearing whimsy. But I mean, I'd like to think I'm less of a prick than Lionel Hutz, but who knows? Coffee. So if you feel a sense of knowing or respecting those of us with ADHD in whatever small measure, I'd invite you to listen openly and honestly to their experiences. So yeah. I don't feel good about it. Let's talk about the trajectory of ADHD discourse right now, okay? I don't feel good about it at the moment at all. And I actually am planning on doing an entire episode where I talk to a fellow neurodivergent friend, and we're actually going to drill specifically down into, I don't even have TikTok, but things like TikTok, we're going to talk about our frustrations from it. But I'm not happy with the way things have gone. Initially, I was optimistic. I actually think I was fairly lucky. So I was diagnosed just a little bit around my ADHD diagnosis. So during the 18 billionth lockdown in Melbourne in 2021, I just started having these things that I noticed. And I think it's in the absence of I was doing an outreach role in the housing sector, where that involved a lot of commuting to and from work and being out and active. And it was sort of the litmus test of the petri dish, being confined at home for the greatest part of 2 years, public health, all that. Let's not get into the COVID bullshit right now, shall we? But I remember one day trying to read an email, and I'm a fast reader. I'm an avid reader, typically. I'm terminally online, so that helps. And I remember having to slow down and read the words out one by one, and I was like, what the fuck is this? Now, I'm a hypochondriac. Again, probably because of my overactive brain. And I'm like, someone calls me, client, and about 3 or 4, they actually, it takes, I find that generally it takes a lot for a client to get pissed off at me. And they were like, hello, are you listening? And it really felt like kind of that pause, stop, VHS style, you pause between the commercial breaks and the scene jumps. And that's been a feature of me trying to pay attention to what people say my whole life. But it was so intense. And I remember calling my boss and being like, dude, I need to take sick leave. Something's up. And I was genuinely rattled. And he was sort of like, okay. I went to my GP and I was like, man, I've got fucking brain cancer or something. Anyway, talking through some things with a psychologist that I was seeing at the time, because, lockdown and all that. And there was a moment where it's kind of now that I look at it, it was probably the memory that got me started on this whole process. Just talking about how I'm frustrated that I feel so incompetent and stupid despite being an intelligent person. And I remember a day I was working at McDonald's, 2004, 2005, little teenage me, and someone I went to school with was like, I don't actually get you. And I said, what do you mean? Is you're like topping the class and you're not getting how to put together like a Big Mac. It's step by step. Like, we've got diagrams and stuff. And I thought, fuck, he's right. And my boss had actually pulled me in and sat me down and got me to draw out the burgers. And that was so shameful for me as an intelligent person. And she actually asked me, do you have a learning disability? And the defensiveness of I was fuming. I didn't say anything. I thought, fuck off. Learning disability? Mate, I'm topping my classes. Piss off. That was actually a good pickup on her behalf, and something I should have seen. And now this is a funny example, and sorry, Mum. You're all young and dumb once. So late 2000s, friend with ADHD, we're all going out, right? go out to the pub, go out to the club, whatever, uni night. Old mate brings along some Dexies, and I'll try it anyway, glub. And everyone else is like, oh, everyone else was fucking fried except me and this other dude. And he goes, are you feeling it yet? And I was like, no, your drugs are shit. You know what? You need a better psychiatrist or something, man. You're getting gypped. And he's like, dude, you should be off your face. Like, the fact that you're not means that you might have ADHD. And I remember the defensiveness of going, fuck off, man. I've got a good GPA. Discounting all the stress and all that stuff that took to get there. And we'll go into a little bit further. And I just remember thinking, and when it came time for the actual assessment, and because I was so worried, and my GP was actually so concerned that there might be something organic going on there, which it is. ADHD is organic. You're born with it. It's congenital. It's neurological. I remember her using those two examples, and she said, did you not reflect on that, think that you might have it? And I thought, no. So even I had paid thousands of dollars for the assessment, and there I was still getting defensive about it. Me, I'm high functioning, quote unquote, high functioning. Anyway, I just thought that's kind of some funny examples that's what led me down the process. And the diagnosis itself, initially, it was liberating. I remember just feeling this sense of healing a lot of not only my own internal bullshit and self-gaslighting, but being able to look back on a lifetime of messages I'd received from family, friends, school, and work, and going, oh my God. So it's not just anxiety, quote unquote. This is, wow. And the more I read into it, and this is when, around 2021, that's when the so many of us were in lockdown. So I think a lot of us got diagnosed as adults at around that time. And I've spoken to Mom about this because I think that she feels quite a lot of guilt about not having picked it up earlier. And one of my other sorts of reflecting on it, core memories, is about 1997. I remember watching just passively 60 Minutes special. I was 97, so I was 8. And the vitriol and the fear, children being given Ritalin medication, and all these parents talking about, oh, he's lost his spark, that sort of thing, and just framing it as this evil psychiatry. And I agreed with that. For years. Even working as a mental health support worker and stuff, I carried that mindset of, we shouldn't be feeding people meth, we should be giving them strategies. And it's so funny looking back now to my mum, we've had this conversation multiple times, because I can imagine she's quite aware of the impact ADHD has on my life and the guilt that she has. And I experienced mental health clinicians in 2023 have trouble picking this stuff up, okay? People are paying thousands of dollars to get intensive assessments from specialists. So there's no shade on a lot of our millennial parents that just failed to pick that up, because there was this anti-psychiatry culture around it. And fine, there's valid criticisms there. And I think the moral Reagan era hangover, the moral PMRC panic around kids being fed stimulants, I mean, there's non-stimulant options for kids like atomoxetine and Strattera and stuff. But looking back on that, I don't blame anyone. How is anyone supposed to pick that up? I developed such a complex suite of compensatory strategies, and the structure of a syllabus at school, it all, there's no way. No one, I actually don't think it could have been picked up without anything but the finest tooth comb. And I had no other reason to see a psychiatrist as a child, as an adolescent, at least not overtly. So I think a lot of us struggle with late diagnosis as adults, but initially I found it really empowering. It framed a lot. It gave a lot of context. But now, I'm going to be honest, the way a lot of people are talking about ADHD, because they're so burnt out on seeing it in the algorithm, hearing people talk about it, hearing people talk about getting diagnosed, I've kind of withdrawn. I actually feel a bit more stigmatized. I actually think that in 2023, where we're at now, with how people are talking about ADHD, and I think in some sense rightfully so, number one, because us ADHD, so shut the fuck up about it, but also because it's all over social media, blah, blah, blah. But I've retreated, I've felt like I need to I've gone back pre-diagnosis, and it's almost like carrying that sort of, okay, I need to shut up to placate society and the community because everyone's sick of talking about it. It used to be something that I valorized and talked about a lot, and I actually think it's heading back to a point now where the kind of the sociological level, the macro scale level fatigue around it from others who don't necessarily understand why we'd want to be talking about it so much. I do actually think that I've kind of gone on a bit of a bell curve, and now I'm kind of in a space where I'm feeling more stigmatized the more it gets spoken about, because the way ADHD is spoken about at the moment, it's not good, to be honest. It's not good. And yeah, interestingly for me, a lot of this sounds very depressive, and look, I make no bones about the fact that I've struggled with like clinical depression and anxiety for years, ever since my adolescence. But this year, I've actually improved so much on my underlying depression and anxiety, and that is in complete regard to targeting how ADHD has affected my sense of self, my well-being, all those sorts of things. But, so for me, I don't think the underlying issue is necessarily depression or anxiety, and it could be, negative beliefs, core beliefs. But, so for me, I feel like I've kind of, quote unquote, cancelled out the mood disorder kind of component as to why I'm helpless about it. It feels external. I get it, right? I can imagine a lot of you seeing wonderful pages, really, things like Self-Love Rainbow or Awakened Neurodivergence or Jen has ADHD or memes and that sort of thing. I can imagine a lot of you are getting this sort of sense of feeling like it's a bit of virtue signaling type rhetoric, because we can get pretty indignant about it. And to be honest, I'm really increasingly annoyed with an in-group, out-group social bias that's happening a lot with neurodivergent folks, where people are sort of, it's almost this demeaning, sarcastic attitude towards neurotypical people. And I get it. But also, guys, we're only here and able to function with the help of neurotypical people who know us and love us. And I can't express, it's too complicated and deep-seated and potentially might maybe even offensive to talk about the resentment that we have, the social comparisons, the feeling of being judged, all that sort of stuff. So yeah, a lot of us are, as we work through this diagnosis process or this identifying process, we get really angry because neurodivergent people, research shows, have a high justice orientation. And I wonder why. But I'm not feeling valorized, or I'm not feeling ownership of my neurotype. I'm shrinking back into the shadows. And that's why I wanted to sort of talk about it today, because I'm fucking sick of it. I feel like I'm crawling back into my hole because I'm just watching this. It's mainly passive and sarcastic, but there's actually a lot of underlying vitriol from a lot of you out there. And there's a sense of fatigue in it that actually, it's interesting watching people's reactions. If I say the letters ADHD, you can see aggression rise up. In fact, people can go from dismissive to flat out oppositional, or even crass. So I feel like I'm backpedaling on a lot of the therapeutic in self and community progress, and I'm sure I'm not the only ADHD out there feeling similar about this. So when I think about what I think you're thinking about ADHD, this is how I feel. And I'm going to go back to some places that, when I talk about stigma, let's talk about some examples. And these are places I didn't want to be taken back to. And I have some more extreme examples, but they're so intense and potentially triggering for other people that I want to talk about them. But I just want to raise this is where it's probably going to get a bit dicey for people. So this kind of renewed sense of stigma around being proud and owning my ADHD, with that stigma, I get taken back to some pretty isolating places. I'm right back in primary school and high school and wondering what a fucking idiot I am for having just spoken my piece, because I obviously didn't read the room, and the wind in the conversation's long since changed, and I'm getting looks of confusion. I'm in one of many work meetings in various spaces, physical spaces, where I suddenly realise, I've way overshot the mark on my turn to speak, or missed the boat on what was actually relevant, because I was so insistent on getting my hyper-focused topic out and the dopamine rush that came with it, that I've overshot the mark. The time's passed, and I'm infuriated for having missed that, or not read the right moment, or feeling self-conscious because everyone gives a look like, dude, we're talking about the budget now. We're not on that, story of my life, not just work all the time. I'm being passed up for promotions because the person who could work at a consistent rate ultimately trumps the guy who, while he's great, he's brilliant skills and potential, fucking hate the word potential, because that's he struggles with reliability. I'm back there being passed up on friendships and relationships due to that same word, reliability and potential. And a lot of the time, the more of these experiences that accrue over life, it becomes this self-fulfilling prophecy where you essentially see yourself as unreliable, because you get everyday data many times a day, whether that's feedback from people, whether that's things you've missed, stuff you've lost, promises you've accidentally broken. You can develop a sense of being unreliable. I've been told many times through my life, you're a great guy, you're just not reliable. It's really hard to reconcile this sense of, you're a great guy, but you have this major flaw that is expected of people. In this stigma, I'm being shushed at a moment where I was bursting to tell someone about an accomplishment I just had, a success. And successes can be few and far between with ADHD, or even just something funny. But I've just come in a bit too hot. And again, maybe not reading the room, or being a bit too kind of loud or hyperactive about it. And I noticed that. And now I'm deflated again. The worst of it is this feeling of this looks. It's the look. I've gotten it from my mum, my teachers, my friends, myself in the mirror, partners, everyone. And it's not anger or malice. It's not even pity. It's confusion. And that is the hardest part for me. It's the confusion. And I know what's behind that, how could such a bright, intelligent, and thoughtful young boy or young man not get this simple maths concept? Why do we have to put him in remedial maths when he's topping the other classes? Couldn't he just have swept that last bit up in the corner? It's right there. He was looking at it. Couldn't couldn't he tell that that chick was clearly hitting on him and making moves? Because his brain was obviously off in some tangential thought loop about some abstract, unrelated thing at the worst time. Again, that look of confusion, I tell you what, in moments like that, prior to my diagnosis, I remember thinking at times, I actually wish I had a quote unquote real physical or intellectual disability right now, because I've got just enough panache or whatever to have picked up on that, and that would have made this less awkward. At least I'd have a reason, not this invisible sort of sense of being a fucking idiot. Again, I'm with that stigma. I'm back in Centrelink. I'm at the unemployment queue, and another of a long string of failed casual jobs, shaking my head, and I'm saying, surely this can't just be generalized anxiety like the counsellor said, as I'm applying for yet another round of youth allowance to try and move back to the uni. Because for some reason, I don't seem to be able to hack just studying and working full-time when my seemingly quote-unquote normal peers, like they're living their own places and balancing both. And those social comparisons dog you every single day. Every single day. When things got to their worst, in terms of stigma, feeling unable to talk about these things to many people means that you internalize a lot. That sense of trying to catch up with everyone despite your best efforts. You push yourself, you become a perfectionist, you overwork. And because that gets rewarded, it gets your results, you continue to overwork at the expense of your own health. So, in terms of stigma, it's 2011, May 2011, right before my birthday actually. And I'm wandering the streets in a state of proper delirium, dissociation, psychosis. I'm completely delirious because this condition has pushed me into a nervous breakdown. I have emergency services pull up and ask me if I'm okay. And I say, I honestly don't know. I need to chat to someone. All right, come with us. And I'm sitting there in an emergency department, and I'm feeling this refractory guilt and shame as I, Brady, the psychology graduate and the disability support worker who, quote unquote, should know better, it seems like I'm in worse shape than most of my own clients right now. I'm being told by a really dismissive inpatient psychiatrist who was on the phone to, I don't know, sound like he was checking his stocks or something, waves his hand, says, look mate, you're just intellectualizing and you're obviously over talking to avoid emotional pain. You need to learn skills to be able to identify your emotions. And as I'm sitting in there out of my mind's racing so fast, and I say, my whole life is emotion. And then he goes, well, you're being too emotional then. And I said, well, that conflicts with the last thing. And he's basically given me a don't talk back. And he's walked off, and that's it. So sent it out the door. So there's a certain regional hospital I'll never forgive for that. Another fun example of that, I remember seeing the psychologist, and this is like 2 a.m, so I get it. People are burnt out, tired. And the psychologist I said, look, I'm completely out of it right now. I don't normally ask for these sorts of things. Could I maybe just have something to calm down? And I copped just fury. You're drug seeking, blah, blah. I believe she might have even used the word junkie. And I'm like, are you serious? Are you serious? I had never taken a benzodiazepine in my life. I didn't even know what they fucking looked like. So anyway, so I'm shunted out of there pretty quickly. I decompensate pretty rapidly. Things get worse. And I actually end up having to have a brief stay in hospital just to recuperate from that. And I remember trying to make sense of that with mental health professionals later on. And I get tentatively misdiagnosed with bipolar years down the track, and the way I think it works with psychiatry a lot of the time, this is a private professional, but I think someone's treating you with meds, it's medico-legal, they want to kind of hedge their bets and avoid their own risk. And that episode was said to be a manic one, and I, to this day, it possibly, could have been a breakdown, but I've never had an incident like that since. But I was really, really, really afraid of going back there, and a lot of my moments of impulsivity or just being dysregulated, I've gone, oh fuck, am I psychotic? But when I look back at it now, and to be honest, it's only really not just studying psychology or social work or whatever. It's funny, like working in clinical mental health, like that wasn't really a manic episode. I think it was an acute stress reaction to trying to manage undiagnosed ADHD. But hey, years down the track, I don't think I was ever formally diagnosed with bipolar, but I was treated for it, and it wasn't helping anything, so I wasn't getting better. But hey, I'm the patient in this scenario, so I better shut my mouth and, not be condescending, because if I speak my mind, the feedback I generally get as an ADHDer around trying to explore like how I'm feeling in an honest way gets misconstrued, and I've been told things like it's condescending or pseudo-intellectual, and it's like, if anything, really, I shouldn't be sugarcoating it. But anyway, so I get verbose and intense and passionate about mental health and things like that. Not just me, not just ADHD, mental health in general. I'm very passionate about it. And in those moments, I just remember being like, nah, man, you just got to shut your mouth. Like, I know you studied psych, blah, blah, blah. Forget that whole the client is the expert thing. This guy's a professional, da, da, da. Turns out years down the track, that was not the case at all. And I've had more than one person say it wasn't bipolar, it was undiagnosed adult ADHD. So, yeah. Other moments, I'm waking up covered in beer cans with a hangover that could kill the dinosaurs because of my fucking impulsivity with my binge drinking. And I wasn't able to piece the night together, but from the stern looks of everyone around me, that tells me enough that my impulse control or lack thereof made me act stupid. And I never did anything completely reckless, but just the level of drunk I would get, because with an already impaired frontal lobe and impairing that with more alcohol, it's just a multiplier effect. So I just get stonking drunk. And there's many days that I'd miss out on, say, going to the beach with friends after a big night because I was so fucking hungover from pushing it way too hard and just lying there hungover going, why are you like this? Why are you like this? And being told by friends, dude, you need to sort your shit out when you drink, man. Like, maybe you should. And I've never been dependent on alcohol, but I've never been great with my control of it. And that's a common element with ADHD. But that sort of stigma of going, dude, what the fuck? Like, just settle down. Maybe don't have another one, Even this week, I was failing another attempt at quitting smoking. Because again, nicotine, stimulant. Oh boy. Anyway. I'm failing something else. I'm failing putting the last dish away. I don't know, filing your tax return on time, getting your mechanic booked, missing appointments, and having to try and reconcile that. Even now, I tell myself, normal people tell me they do that too, so there's nothing wrong with you. You're just exceptionalizing and trying to be a snowflake. So, conveniently leaving out the fact that these little sorts of slip-ups happen to me all day, every day, and that's when I'm medicated. So in short, thanks to the way a lot of people are talking about this illness, I'm feeling stigma that I haven't felt in years. So thanks, and fuck you. And by fuck you, I mean the systems that are working to denigrate any progress on this issue. I'm going to start with some of my bugbears, and my biggest one is people saying, "Oh, ADHD is everywhere these days." And the reason isn't because everyone's out there trying to get diagnosed so they can get medication because they saw something on TikTok. I'm sure there's people out there. And yeah, sure, right, okay. The actual lifetime prevalence of ADHD in the population is around 5% for males and 4% for females. So think about that. That's 1 in 20 people. If you have 100 plus people on Facebook, do the math, you've got at least 5 people with ADHD on your kind of file. But here's some other actual reasons that I'll offer for you. Number one, it's actually quote unquote your problem. You're online too often. If quote unquote all I'm seeing about on this and that online is ADHD blah blah, then you're online too often. Go outside, touch some grass, get a fucking hobby. I'm not kidding. Like, if this wasn't an issue, then the algorithm wouldn't have you as ensnared as it does. I don't care if ADHD and neurodivergence are trending topics, whatever. They won't be soon. The fad will pass and we'll go back to being relegated to the shadows and you'll feel better. Huh? Okay. But you're feeling temporarily oversaturated by the presence of way too many of these faux ADHD TikToks. But that's not the responsibility of content creators. Content creators are being pushed by the same dopaminergic processes that have you, a neurotypical person, hooked on this shit. It's your responsibility, not mine, to diversify your life. Find some new topics. Find some conversations. Stop blaming the algorithm and go outside. Spend less time on your fucking phone, and then maybe you won't be as exposed to this deluge of that's all everyone's talking about. Because I tell you what, out there in the community, talking to people, you don't hear it much, to be honest. Even though you hear it now more than ever, you don't hear it much. There's a lot of confirmation bias that comes in here. Second possible reason, you might be neurodivergent yourself. If you are, or if you have family members especially, if you have anyone in your family with some kind of observable traits or even a recent diagnosis, it's extremely likely that there's a possibility you may either have some traits, maybe perhaps not meeting the colour for a disorder, or you may have it yourself. ADHD, recent studies show that there's been a heritability lifetime estimate between parents, and this is either 1 or 2 parents, of up to 90 to 95%. And there's meta-analytic empirical studies to confirm this. So that means if anyone, and I mean anyone, in your immediate family, or in a lot of cases your entire extended family has it, then it's actually likely you've probably got some traits of it yourself, or you might even meet the criteria yourself. Which leads me to point 3, reason 3, and this is one I think a lot of people don't want to hear. Look, there's a lot of mechanisms around this, and people say your vibe attracts your tribe, one of the sort of main thrusts of Inner Strength Check is a lot of the communities I'm in, they are packed full of us neurospicy folks, I'm telling you. And neurodivergent people attract one another through some process, and subjectively it feels coincidental and borderline mystical, the amount of people now that are like, oh fuck man, sorry, that's just my ADHD playing up. And I'm sure that sounds flippant to some people, but it's like, dude, we are 20 minutes into a conversation about like this one topic, and I don't even know where you work. It almost feels like borderline mystical, but I think it's a combination of a lot of subtle and unsubtle factors. I think neurodivergent people, there's probably a lot of less unconscious and reflexive kind of behavioral microaggressions, so we kind of click easier. there's a conscious or unconscious understanding that someone, if you're listening to this still, just a bit more of that capacity to understand. What I'm saying is, if everyone in your inner friendship circle is talking about ADHD and all that sort of stuff, that could be a tell too. And maybe your defensiveness or your flippancy is some internalized stigma on your part. I could be wrong. I'm not diagnosing you. I'm not your fucking psychiatrist. But I've noticed a lot of people who exhibit a real kind of neurospicy flavor themselves, and they're surrounded by friends who are like, oh, I got diagnosed. And they're sitting in there getting really shitted off about it. And it's sort of like, you know what? Social spaces full of neurodivergent people are intense. We talk a lot. We're loud. Like, it's a lot. And I have a lot of neurotypical friends. And a lot of neurotypical friends amongst groups that are like everyone. It's sort of like, I feel like everyone except this person, that person. No, they're definitely not. But it just feels statistically, anecdotally, like we cluster together. So I think a lot of people's knee-jerk reaction, I wonder how much of that is a bit of a projection. Another reason, going back to before COVID, was the ultimate petri dish, the ultimate litmus test. Think about it. You removed a lot of our stimulation, all of our structure, so huge adjustment difficulties, no stimulation. What did you expect from a brain that's lacking in blood flow to the front right prefrontal cortex, which requires self-stimulation in order to bring dopamine levels back up to your normal level of functioning, which is the entire mechanism by which ADHD medications treat this illness? It stands a little bit to reason that understimulated people with brains that require stimulation, which may have had some baseline everyday stimulation, discovered that they had ADHD during lockdown. Because I tell you what, I feel like my brain melted at one stage during lockdown, and not in a sort of depressive kind of way, just cognitively. And I really do think that had lockdown not happened, then I might never have picked it up. But who knows? I might actually be one of these, ADHD's everywhere, it's all everyone's talking about. That could well be me, right? Another thing, if you truly think it's all that everyone's talking about, change the fucking topic then. Initiate the topic about something else. Do it nicely, don't downplay it. But if you truly feel like everyone is just circling the wagons on this, change the topics. And if you don't have something to talk about that you're interested or passionate about, that's not on us. That's on you. Last kind of counterpoint, I won't get into it because I'm not going to be some Reddit neckbeard about it. Oh, cognitive distortions, confirmation bias, cognitive dissonance, all that sort of shit. There's a bit of that going on, right? But I want to sort of, from a perspective of a neurotypical person or someone who's frustrated with it, you've got some valid criticisms, and I'll give you a hint. It's all capitalism, baby. So capitalizing on this explosion of talking about ADHD has been, I call them assessment mills. And while I appreciate the access that provides people for testing, in some ways also fuck them, the bad ones. It's very obvious that a lot of opportunistic services have picked up on how backed up wait lists are and how hard it is to access ADHD assessment, because everyone's querying it, because everything from smartphones melting our brains to the stress of modern life to people with ADHD going, oh, that's relatable, that's valid, I'm going to go explore that. All those reasons. There are so many telehealth and online clinics out there now, and they are just ramrodding people through, because it's, you know what? ADHD assessments are expensive, and that is the barrier. People talk about, oh, self-diagnosis is valid, da da da. I'm not actually of that opinion. It's only valid because our system is not structured in a way to support anyone with a mental illness, but especially not more specialist touch diagnoses and things. It's too expensive. It's too inaccessible. It involves so many planning, prioritizing, and organizing steps to get through the assessment. I felt like I was back at uni getting my goddamn diagnosis, and I almost quit. And I know many people who've approached me about, oh, I think I might have it, and I've talked through it, and oh, I'd maybe try this, that, and caveats. I'm not a psychiatrist. I'm not assessing you. Da da da. Don't know. It could be likely. It might be worth working. And they've just given up. They can't afford it. My ADHD assessment was $2,200 up front, and if I was poor, I would have been fucked. So yeah, and often people with ADHD and neurodivergent people are amongst the most socioeconomically disadvantaged because we have so many functional difficulties. We end up in dysfunction. We can become very easily homeless, drug addicted, mentally ill. We can acquire secondary issues from that: psychosis, drug-induced brain injuries, actual brain injuries from injury. Untreated, we can sometimes become violent, aggressive, narcissistic people. We can become perpetrators of family violence. We can be much more susceptible to family violence and trauma. And in fact, there's a lot of research to show that a lot of the sensitivities that come with being neurodivergent lead us to being much more susceptible to personality disorder, to schizoaffective disorder, to drug-induced psychosis. So this sad irony, and it makes me so sad, I want to cry about it like all the time, is that an ADHD assessment is expensive and the wait lists are long. So if you don't have that financial capacity or privilege, which with the cost of living crisis many don't, you're fucked. You're just meant to survive on your own. And I'm really irritated with the explosion of a lot of these clinics that are just one and done, and a lot of them are just trying to get through so many of these assessments as quickly as possible that actually when you go back, there are a lot of misdiagnoses happening, and these kind of assessment focused centers, there's so little follow-up and there's so little time performing a thorough evaluation. I was lucky. I had a really thorough ADHD assessment, and some of the ones I've heard, people walking out in 15 minutes. I'm sorry, but unless someone has no mental health comorbidities, you can't diagnose ADHD in 15 minutes. I mean, you might be able to, and you might say that you can, but I don't think that you can. I think that is unethical. Anyway, another valid criticism of yours: social media, TikTok. I'm not going to go down that route today, but just consider the fact that a lot of us are getting excited and wanting to share and build community because we're coming out of the shadows together. What that means is there's more group posts, there's more engagement on a lot of these things, which means that gets pushed further up the feed, which makes it seem to you, the other 95% who might not have ADHD, that it is quote unquote everywhere. In which case, again, fucking go touch grass. It's not my fucking problem. Another valid criticism is this sort of concern around the pathology of it. Oh, it's all disordered. Everyone's like saying I've got a disorder. Oh yeah. Guess what, genius? That's why the term neurodivergence is in vogue right now. Neurodivergence wasn't coined by some obnoxious e-girl in 2020 who constantly refers to XYZ in this space during corporate webinars on Zoom. It wasn't coined by some SJW. It wasn't dredged out of the earth by some of these blue-head SJWs. This has roots in actual academic discourse in sociology, social psychology. Go look it up. It's actually an empirically derived term, neurodivergence. So yeah, if you're concerned about pathology, we are too. If a weirdly named disorder, adult, like ADHD, that doesn't really touch on it and it doesn't explain it enough or well. It's awkward to pronounce, it's weird to think about, so imagine fucking living with it, alright? And if you're older than Gen Z, you grew up with the stigma. So going back to that example from the 90s, you know, how was my mum to know? How was anyone to know? How was school to know? I did well at school. I functioned till I didn't. And that was until adulthood. Even look at the DSM. Homosexuality was considered a mental pathology, and in some insurance billable criterions, which some doctors use, there is still some diagnostic criteria that is pretty much a dog whistle for homosexuality, right? ADHD and ASD were considered discrete disorders until the DSM-4 revised. That's categorically false. So in the 90s, if you got diagnosed with ADHD, you couldn't get diagnosed with ASD because they were thought to be different. They're both highly predicated on neurological abnormalities in which lead to frontal lobe deficits. Autism is a little bit more global and different, but 40% of people with ASD have co-occurring ADHD, and I think the swap around of that, if you're primarily ADHD, I think it's around 16-20%, so there's a lot of overlap. What I'm saying is, even the pathology can be incorrect. We're still languishing this boomer Reaganomics. Pull yourself up by your bootstraps. I've always had a really massive interest in how much American society, going back to John Birch, and all that sort of stuff, Ronald Reagan, all that sort of stuff, and then globalization really infected postmodern global discourse with this really Puritan work ethic, this real Calvinist sort of taint things. Pull yourself up by your bootstraps. That work ethic mentality has been fucking poison for us ADHD folks, but it allows us to hide in plain sight. But we're hiding in plain sight in hell. And what I mean by that is perfectionism is actually a massive, massive part of ADHD. I actually think it should be almost inclusive as a diagnostic symptom. We've got an impaired frontal lobe. Okay? So similar to us sometimes being uncoordinated due to deficits in spatial planning, we have these, going back to the idea that the frontal lobe is the seat of planning and organization, as is impaired. So not only are we playing this overcompensation game of catch up, we're actually really bad, even though we'd like to think that we're not. On a natural functional level, we actually have impairments in being able to correctly judge things like the amount of time something will take, the amount of something effort that something should take, the amount we should be investing in one task versus the other. And a lot of the time, the easiest and best way for us to get past that in a capitalist society, which valorizes success and hard work, is to just work harder. Work harder. So all this shit, it makes me angry, it makes me sad, I feel defeated. I'm not kidding when I say I'm at this sort of space where I've given up on championing ADHD, and it really is quite sad. What's the fucking point when having ADHD means I've been reduced to a joke again? There's no point, and that's how I feel, and I shouldn't, it's not the truth, but it is that. The discourse has led to that level of fuck, I guess it's off the table, it's faux pas, I shouldn't be talking about it. So like, I'm not here for you. I'm telling you guys to fuck off and actually let ADHD be a thing for a while. Let it settle down, it'll simmer down, the algorithms will tweak. But can we shut the fuck up about, oh, it's everywhere, it's overdiagnosed? That's not our problem, that's yours. ADHD Awareness Month matters truly from my perspective the complexity of it, how deep it runs. So look, I work in mental health, right? So obviously I signed a non-disclosure agreement, and I'm sure some colleagues and maybe even some more of my more industrial clients are listening to this. And I'm sure a lot of them think a lot of this sounds like personality disorder. And probably does. If we think about that, right? If we think about personality disorders and certain traits like histrionic or narcissist or dependent. So putting aside those sorts of, all this blah, 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 diagnostic overlap, of fucking course we're going to present like we have histrionic traits. We get very easily overwhelmed. We get very easily excited. We get very easily over or understimulated. So of course we're going to present like we have histrionic traits. We're loud. We have trouble gauging what the appropriate level of emotional response is in a way that might look like autistic to people, you know. And again, a lot of that is misconceptions or comorbidities. And to be honest, for me, neurodivergence is a handy concept because I think the lines between ADHD and ASD with those sorts of things blur to a point of being almost meaningless. But going back to this whole, because misdiagnosis or diagnosis of things like personality disorder but missing the ADHD element, it's a big point of contention within the literature, within practice, and just in society. But going back to this idea of a lot of neurodivergent people, I think, come across like they've got a full-blown personality disorder. But a fucking course, we're going to come across as having something sort of unstable and wrong with our personality. We don't have an enduring sense of self when we're forced to be social chameleons, when we're constantly gaslit and told what we're doing is wrong or silly or indifferent or dumb or whatever. I've heard all those. I've been called an idiot so many times by people who I've had interactions with that are one or two words. I've been called a dumbass by people like all over the shop. And in all cases, they were right in that moment to the context. But you drip feed enough of this, you know, death by 1,000 cuts, Lang Che this long enough, of fucking course that's gonna have an enduring impact on your sense of self. Of fucking course we're liable to come across as even narcissistic. Most of us are, you know, have possibly some, you know, the narcissism isn't pretty rare as a clinical thing, but like, I like to think I'm pretty reasonably agreeable or chill or whatever, but when I really get on my high horse about something, I probably sound arrogant and narcissistic because I'm just delivering it with bluntness or whatever. Of fucking course we're going to talk about ADHD, and it's a preoccupying theme because we're prone to hyperfixation on topics of interest. It's what our brains do. Of course we have rejection sensitivity dysphoria, and I'm going to be doing a lot of rejection sensitivity dysphoria because I think it applies a lot to not just neurodivergent, but people in general in situations like bands, tabletop, that sort of thing. But in a fucking course, we can become psychotic, especially if we're undiagnosed. People break from this stuff. So for me, ADHD, it runs to the core of my being. It's expressed in my every action. To me, it's also just a label, but it's completely and globally all-encompassing. It's the root of my depression without question, and I'm working on that. Anxiety, I'm almost at the stage where I'm like, anxiety is just ADHD doing its thing. Particularly generalized anxiety. I'm lucky enough to not suffer from panic symptoms, but I really do think my quote-unquote generalized anxiety, it's just my adult ADHD going haywire. Substance abuse, of course we're going to suffer from that. The lid's off. We're already kind of drunk because our frontal lobe ain't working as well, which is what happens when you get drunk. Look, to be honest, all of this stuff, the complexity and the risk factors, they don't lead to good outcomes with people with ADHD. I slept about 1 to 5 hours a night from the time I was about 16 to about 30. So it's pretty likely I'm going to die earlier than other people, because you can't do things like that and binge drinking and smoking and whatnot and be alive longer. It just doesn't, life doesn't work like that, except for some freak happenstance. But you know what? I was born 3 months premature and basically dead on arrival. I shouldn't be here, so really, anything else is a bonus. I promise I'm getting close-ish towards the end of what I wanted to talk about, but I've still got, I think I want to talk about the negatives and the positives of ADHD and what diagnosis has done for me and what I think we as a neurodivergent community should do next. So negatives, self-esteem, all this stuff that I've talked about today, it's our core deficit. I could do an entire series of episodes on that, and I think I actually may. Schemas, ideas of self-image, self-concept. ADHD taints everything about who and what you think you are in every situation, all the time. As a worker, as a partner, as a friend, as a lover, as a colleague, as a client, it's all pervasive, and often a lot of the time the feedback isn't good, which leads to my next point: vulnerability to gaslighting and manipulation. I've been lucky enough to not suffer serious sexual assault or physical abuse in my life, but I know many of my female, trans and intersectional neurodivergent homies have, and that disgusts me, that despairs me. There is an undercurrent of neurodivergent women being much more susceptible to being abused and traumatized, and often neurodivergent folks, particularly neurodivergent and non-binary or trans folks who have ADHD, that sort of thing, they might have come from families where the parents themselves might have had it and the way they dealt with it wasn't good. A lot of people are seeking diagnosis for ADHD when it may actually be complex PTSD, because PTSD neurologically induces changes that are similar to ADHD. But a lot of people born with ADHD are more susceptible to sexual abuse, to family violence, to domestic abuse, and we're actually quite likely to inflict it if we haven't had the right treatment. I don't say likely as in, because you have it, you're going to be a perpetrator. No, I mean statistically, there's a slightly higher chance than the general population, and that makes sense. You factor in all this sort of stuff, people are messed up, they're fucked in the head. And especially us guys, what do we tend to do with all that? You know, our culture, we don't talk about it. We don't go to therapy. We abuse substances and kill ourselves, or we abuse substances and we hurt other people because we don't know how to manage our pain. And the pain that a lot of neurodivergent people feel is yucky and complicated. It's not just anger, it's not just sadness, it's complex emotions. Shame and guilt are the undercurrent of my life, and I know that they're secondary emotions, and that's probably why I have such bad issues with anger myself. Another negative, that susceptibility to manipulation has led to me staying in jobs I should have quit years ago. I love my job now, and I've loved a lot of my jobs, but same with relationships. I've been in some pretty disgusting, toxic situations of people I've dated and past friendships and stuff, and talking about situations where I've just persisted, going back to my point of going to hospital, I should have taken forth the brakes for longer than I did, but I just kept pushing to the point of no return. I ended up in hospital, and I would say it's that ADHD drive and the perfectionism, all this shit that comes with it, that placed me there. going back to rejection sensitivity dysphoria, look, I'm an Aussie male. I think that a good whack of what my anger is and comes from is actually rejection sensitivity dysphoria, and that's a common way of us blokes dealing with that not well. Failure, I think I've touched enough on failure. Things that I wish for, I want to learn music theory, I want to learn digital audio workstations, I want to read my Forbidden Lands tabletop book, but I can't. Not just that I feel that I can't. Like, I've essentially been waiting all year for things like that. That's why these episodes take so long. They linger. So these things you enjoy, they're still there. They're in your mind. They just become these OCD style chronic compulsions, but they're hampered by your limited resources or your, more importantly, your perceived inability. I actually have a lot of work to do on myself before I can even get started with those things, even though I'm capable. Anyway, the messages we internalize from others: slow down, relax, all that sort of stuff. I've often thought there's something really wrong with me, just out of the pure fact I'm always wanting to do stuff. I'm not. It hurts. I'm physically uncomfortable and sad if I'm made to just go to work and watch TV and do whatever ad nauseum. It kills me. But comparing myself unfairly to other people that can, quote unquote, seem to do that and live that kind of 9 to 5 life, it hurts. And figuring out the balance between actually living healthily and not burning yourself out, and not being that, alright, fuck it, I give up, I'll just play the game. It's impossible. It's impossible. Cognitive distortions. Oh boy. So because of the frontal lobe deficits, we naturally will get cognitive distortions, which, by the way, are a major feature of depression. Things like black and white thinking, that's a big one for me, not necessarily with others. I'm actually pretty nuanced in shades of grey, and I think a lot of people with ADHD are too. But catastrophizing, minimization, magnification, emotional reasoning, it's all there. And it's all been there prior to depression even being a thing, which is why when I started learning about cognitive distortions in therapy, I'm like, but isn't this just the way you think? Anyway, the cynicism, the nihilism, the misanthropy, let's not even go there. That fractured sense of self, it comes across as very, quote-unquote, borderline personality disordered. But what I've noticed for me, it's not that chronic sense of emptiness that I need other people to feel, which is a common sort of thread with personality disorder. But it's just this endless social adaptation and imposter syndrome. I constantly feel like I'm an imposter. I feel like that right now. I feel like that every time I walk into work. I feel that in every conversation. I feel like I'm needing to fake it and compensate to get through anything all day. And can you imagine what that feels like to your sense of self? But as opposed to people who have a fractured sense of self due to trauma or personality things, I actually think I have a strongly defined and cohesive sense of self in myself. It's the masking, it's the imposter syndrome. And again, I just don't feel like I fit in anywhere besides fitting in with everyone. I'm overly reactive, and it's mostly internalizing. If I wasn't internalizing or baking half as much of my reactions as I do, you'd think I was hysterical. I'm very neurotic, and ADHD absolutely is the causal factor there. It's just overthink. I'm unreliable. I'm trying not to. I can be very productive and organized, but I'm unreliable, and I hate that. My health, I'm fucked. When I'm older, I'm fucked. Like, I'm cooked. That's it. Peace. I won't ever find, quote-unquote, peace. I'll self-manage and I'll maintain ADHD, but it's congenital. I will not have mental peace and quiet and calm. I'll have moments of it, but I won't have it consistently. Which comes to my next point with ADHD. People say, oh, now you're on medication. You can't medicate it the way you can effectively stabilize something like depression or bipolar, where the drugs are in your system, they're stimulants. You need sleep, you know. You'll die if you're on stimulants all the time. So it's basically impossible for us to stay asymptomatic without becoming a drug addict and just taking stuff to nuke all those symptoms, like the overthinking and whatnot. So it can be medicated during the day and sometimes at night, but there's always gaps. So you do feel a bit of underlying resentment where it's like, am I just taking medication to supplant and support being in a society that's structured the way it is? Sure. Not being content with a normal life. I can't do it. I hate it. And I hate that for me. I hate that I can't live the Australian dream, even though I don't want to. I just can't. Again, social comparisons, right? And they're unfair. Unfair social comparisons is a cornerstone of it. Drugs and alcohol. I'm really thankful I've had some insight to stay away from shit like ice and heroin, because ADHD would have fucking destroyed me with that. But I reckon I've probably done a lot of damage to my body, especially in my early 20s, uni and stuff, through binge drinking. Like, how I don't have liver damage is miraculous. I do recall there being a couple of points when I was like 20, 21, and I was like, I'm really sick, and JP was like, how much are you having when you're drinking? And he's gone, stop that, you'll fucking die. And I'm sure I'm going to develop multiple chronic diseases from stuff like that later in life. Weed, I can see the appeal with weed, but I honestly don't know how basically everyone with ADHD on this planet isn't a massive stoner. That shit is medicinal, and like, not in a good way, but it also increases my symptoms. So if I have weed, I'm a fucking dumbass, and then I'm so much stupider the next day. I've got like a double ADHD hangover. So if I was a stoner, I wouldn't function. But you know, anyway. And cannabis is one of the main drugs of abuse of ADHD, because it has that depressant calming effect, and I find that to be really sad, because I think there's a lot of people out there that are drinking and smoking themselves to death to try and self-medicate this. I think in another life, I'd be helpless. I'm lucky I haven't turned out to be a quote-unquote junkie, really, seriously. You know, and I think a lot of people with ADHD are, and it kills them. I know a person with ADHD is no longer with us because of that. I know another person with ADHD who utilised drugs to take their own life because they couldn't handle it anymore. So yeah, there's not much quiet in ADHD, and that's robbed me and ruined me of many good moments I've tried to spend with people where my mind's been overwhere. I just can't get the words right. Yeah. Anyway. But let's focus on some positives, eh? Hyperfocus. When I'm hyper-focused, I'm superhuman. Super fucking human. You don't even know. Like, it's... I really fucking hate the saying ADHD is my superpower. But it really is. When that hyperfocus ticks in, you smash it. And I think that's the appeal of overwork and stuff, is because when that hyperfocus light hits, holy shit, it is like controlled mania. You are focused. You are more productive than the average person. Your flashes of brilliance, I really can't. It feels very ironic, and therein lies the problem. But hyperfocus, when it hits, oh baby. ADHD's definitely informed my motivation to become a social worker, I think, without me knowing. It kept me going through some frankly disgusting workplace conditions and environments in the past, but that really strengthened my resilience and my resolve and taught me a lot. It certainly informs my music tastes and my hobbies. all of my interests. I mean, I feel that my life is very self-selective around being born of things that stimulate me. Same with my values: compassion, justice, fairness, empathy, creativity, love of arts. Oh, man, absolutely, it's my neurodivergence that not only can make me creative, but I love creativity. I'm about to head off to a gig soon. Like, my relationship, my partner and I both have it. We didn't find out about ADHD until years in the relationship. This is the longest relationship we've both ever had, and I've never had a closer connection to a partner in my life, and it's not just because of that label. We just get it. My family, going back to heritability, Mum and Cal, if you guys are listening, sorry, but going back to that heritability estimate, I think we've had conversations around this, but even my biological father, who I didn't grow up with, I met him in my 30s, classic ADHD, but Mum's values, her deep love of nature, her deep interest in creativity, in science, her justice orientation, her expression, her emotional depth of ADHD absolutely informed all of that. Same with my sister. We're very intensely passionate, sensory seeking, loving people. And I think that ADHD, we're conscious beings. You have values and blah, blah. We're not just driving an autopilot with all this, but I think ADHD formed that around us. ADHD gives me enough internal batteries to keep me physically moving at times where I think I've had periods of depression where if I look back, I'm like, how the fuck was I not bedridden? And I think that ADHD, I've got enough of the H in there, even though I'm ADD, to keep up and active and going and moving through times where I could have just laid there comatose and just not eaten and whatever. Seriously, ADHD has pushed me through a lot of mental health stuff. I think it's the Duracell battery that's kept me going. The constant thinking's a bugbear, but I do a lot of critical reflection. I have a lot of deep thoughts about life, man. I actually think a lot of self-ascribed people that are dreamers and deep thinkers, I think they might actually just have ADHD. That's a good thing. It's a good thing. My love of research. I love research. I love learning. And empathy. Living with ADHD is a fucking joke. It's never-ending stress. It's constant pain. So seeing others struggle, I get it, but I also am very strongly committed to helping others with that. Exercise. I think COVID killed it off a bit for me, but it's a need. There's evidence to suggest that exercise, particularly high intensity exercise, is equivalent to low dose stimulants and has more enduring effects over the day too. I don't function without exercise or eating well. I have to be healthier, and I've always been interested in health, and I believe ADHD have pushed me with that. I think a huge portion of the fitness industry have it. And you know what? Fit and healthy ADHD folks are some of the most well-adjusted people you'll ever meet. So they're not even really ADHD, they're ADH. Work ethic. I'm not a man of many talents, but I'll outwork you and everyone else out there to the fucking grave. If my loyalty feels well placed and I'm in a good spot, I'm not a confident guy. I have low self-esteem, but ask my colleagues, ask my clients, I go fucking hard. In fact, I have to constantly pull back. You can see it in my case notes, my essays, these podcast episodes. I'm too much, but I have a dog with a bone work ethic, and if I think something's unjust, I will not let go. Entrepreneurship, Richard Branson, right? Humour, spontaneity. There's a lot of research around comedians and entertainers and content creators. with an overlap with ADHD. I think I can be witty and funny when I want to. I'm not joking when I'm saying that's got me out of huge trouble before, and possibly even in some situations might have even saved my life. An affinity with others that I, might have a little bit armchair psychiatrist diagnosed with ADHD. For instance, Devin Townsend, abso-fucking-lutely ADHD. And pre even thinking about any of this stuff, one of my musical idols, and just such a creative person and someone who has resolved a lot of this stuff, I think, himself, and is such an empathic, compassionate dude. Going back to drugs or alcohol, I don't actually need them. The only time I've ever really needed alcohol or drugs was clubbing, and that was because apart from my friends and stuff, it was just a heap of boring cunts in a box. Now I realise that's my idea of hell. I mean, have I experimented with some stuff? Sure. Do I require stimulants, though, to be bouncy and full of pep at 3 o'clock in the morning? I don't, but everyone else is out there wasting dosh on coke. I don't need to drink at gigs. I don't need to do drugs at gigs. I just go and it hits me and I'm like, fuck. Yeah. And another thing, I think, consider this a bit of a coming out of my shell here, but if I do have some underlying autistic traits, then ADHD, I think, has served to make me more ambiverted and more approach-oriented in my adulthood to help whatever deficits there might be there. I suspect I'm what we call AUDHD, but I actually really think that ADHD makes me more social, and I know a lot of people struggle with introversion and overwhelm due to ADHD, and I do too. But I actually think it's what drove me into my shell, but also what got me out of my shell. So, yeah, there's heaps of other stuff. I mean, I never want to stop learning, and I think I've done a lot of productivity and unconscious self-medication with productivity, and that's going to be a part of this podcast too. And I think, although I don't practice it, I'm a productivity freak, and I love helping people with that sort of stuff. I think it's a positive not being content with an ordinary, normal life. I hate it. I don't want it. Therefore, I don't need to climb the ladder. I mean, I came from poverty. I could be opinionated at times, but I'm actually pretty fucking humble. And as hard as my life can be, I'm content with it. My justice orientation, I can incorporate the worst of human nature because I've struggled and I've watched others like me struggle or disadvantaged people struggle, I really do think ADHD gives me that kind of frame of mind, and I've got some morbid interests. Like, I love listening to stuff about like genocide and dictatorship and stuff. You listen to metal where it's like death, and I feel good about it. That might disturb other people, but I think when you spend so much time in thought, you work through some of that stuff, and it doesn't bother you, and it helps you stay principled in a pretty nihilistic world. Resilience. I think I've lost a bit of resilience post-lockdown, but ADHD absolutely has taught me resilience. I'm a very resilient person, and so is anyone else with this condition. Interpersonal skills, rapport building, reframing, collaborating. I feel socially inept most of the time, but I actually think I do well with people. And to survive, us ADHD folks, as counter-dependent and stubborn as we are, we need you guys. So naturally, we become diplomatic, and I think a lot of you guys need us, because we push, we motivate, we lead, we inspire. I also suspect that a lot of self-identified centrists and devil's advocates have ADHD, but that's not me. I'm hard, radical leftist, I think. I'm utopian no fault, and my ideal society is a stateless, leaderless, anarcho-communist style dream. It's probably not going to happen, but I will use my life to see where I can help to at least push the needle towards something like that to make this place better. My justice boner is a bit Viagra. All the diagnosis did was steal me even further. I'm here to fuck shit up, and I don't care, because as I mentioned, I don't actually think I fit in here. So I can be diplomatic and moral, but I'm also not as concerned by the hierarchy or the status quo as a lot of neurotypical people. So I'm not bound by feeling like I need to keep oppressive systems in place. And my own volition and willpower obviously got me through it, but I would say with the utmost conviction that all those positive traits I've talked about, ADHD, I recognise other people's lived experiences is completely different, and I'd encourage people to think of their own. Would I trade all of this to swap it out for a neurotypical brain? Yep. In a second. It's kind of taken up to this year to finally truly stop hating myself so much, but I don't like living with ADHD. Life with ADHD is hell. It's nearly killed me many times. I've not had suicide attempts, but boy oh boy, I've had times where I've definitely had suicidal thoughts where I'm like, I just want to die. I want to end it all because I'm just exhausted. I want my brain to shut the fuck up. Even in happy moments, I can laugh and just go, oh my God. At least when I'm dead, it'll just be the void. God, that sounds so relaxing. So just some last thoughts here. I know this is a long one. What diagnosis gave me, which could be its own episode, and I'd love to hear your feedback about what diagnosis gave you. Obviously, what diagnosis gave me was healing. Context. I remember ringing Mum when I got diagnosed, and I was talking to her, and I just remember saying to her that day, like crying. I just felt decades worth of relief. Tools. Now I have tools and strategies. Insight. I mean, I thought I had it around the depression and anxiety stuff. Nah. My insight into myself and other people is 100 times better. And it was specifically going down this path that helped me. So getting diagnosed has helped me help others better. And diagnosis of ADHD has given me an inkling that perhaps some of this stuff isn't just contained in ADHD. Maybe I do have some autistic traits. So I do actually have an assessment book next year, and that's had its own interesting process of internalized ableism and stigma. That's maybe another episode. And I'd say that my pie chart of neurodivergence really is probably 80-20 ADHD and ASD. So how wonderful though that diagnosis could lead to further answers, even if that answer is, nah man, you're just neurodivergent. It's all ADHD lol. Which is an expensive answer, but anyway. I like to think that ADHD folks can make it. I'm not rich, but I've completed 3 very difficult degrees. I work really hard on intense and complex work, and my hobbies are incredibly dense, to say the least. I beat a low socioeconomic upbringing, severe disadvantage, stigma, trauma, failed relationships, failed careers, failed opportunities. I have ADHD as much to blame for that as I do to thank for getting through it. People. Mum went the nature route with her hyperfixation stuff. I went the people route. But I see her love of science in my love of evidence-based practice, empiricism, but also critical and radical social work practices. And I would say that being neurodivergent, specifically ADHD, is a huge component of that. And the only way you're going to get that out of me is to physically remove it from me by killing me. So until you do that, I'm never not going to love people as much as I struggle with them, and I'm never not going to love helping to make the world better. And the only way you're going to stop that is to put a bullet between my eyes. And speaking of people, I think I'm adaptable. I can hang out with surfer bros where we have literally no shared music interest, then I can go to a death metal gig the same night, wake up and play D&D the next day. The playing field's equal. just don't be a cunt, and we're fine. Oh, I mean, I've dated bloody Barbie girls that couldn't be more neurotypical. I know that's a sweeping generalization, but whilst my partner, my neurodivergent partner, she's my fit, my soulmate. It's that excitability and keen interest in people across my lifespan that I think just keeps me good at fitting in and adapting, but being interested in everyone. So, ADHD, at the end of the day, it is just a disorder, but also I'm really trying not to make it my personality here. Frankly, I have too many hobbies on the go for that to be an issue. But the reason I drive all you guys nuts about it is because it's inexorably tied to who and what I am at my core. I'm inseparable from it. It's me. I am it. If you can understand just how liberating it was just to get some third party to rubber stamp those 4 letters, then you'll understand truly why I'm so upset about the way things are going with the way ADHD is being dismissed again. I don't care if this talk is shared with another person. It's a long one, and I'm not going to edit it. I'm just going to leave it as it is. But if you've gained something from this, if you'd like to share it with someone who has ADHD, and ask for their feedback and their take, because I could be way off the mark right now, then feel free to do so. But just know this. People with ADHD who miss a diagnosis don't just miss a diagnosis. We risk physical illness, substance abuse, domestic violence, suicide, poor psychiatric prognoses, and an early grave. So, around this whole ADHD Awareness Month, just shut the fuck up for a second and let us speak. Because there's folks out there, by doing this awareness raising and by being honest about ADHD and what it does for, to, and with people, we can be saving lives. And that is the ultimate point. Thank you for listening to my tangential ramble. And I hope this was useful in some form. Thanks.